Hey, let's save the tooth. I'm Dr. Bernard from Dental Designs in Singapore. So today I wanted to talk to you about how do we save a cracked tooth. Firstly, we want to talk about how a tooth actually cracks in the first place and how severe is the crack. So if you're at home and you are thinking about how bad is my cracked tooth, the first thing that you want to realize is it painful? Now, if it's not painful at all, most likely you have what we call a chipped tooth. That means the enamel of the tooth just broke. Then the most severe is when you get a fractured tooth. And the most severe of cracks would be a tooth that splits in half. And unfortunately, in that kind of scenario, we can't save the tooth. But any other situation, we will want to save it, okay? So let's talk about the chipped tooth first, the smallest of cracks in a tooth. You can either sometimes just leave it alone, or if it causes a little bit of roughness on your tooth and you want to get it fixed, go see your dentist and he or she will be able to put a bonding on the tooth, like a composite resin filling, okay? And if you want to have something a little bit fancier, you can sometimes actually put a ceramic piece to cover that tooth. Very easy to be done and usually quite painless. And the other thing that we want to do, which is mostly in the majority of cases, is that a crack is starting to get a bit bad. That means you bit down on something hard maybe, and you started to feel a zing in the tooth, like an electric shock. Now, you really need to see a dentist immediately to make sure that the crack doesn't get any worse, to the point where it splits in half. That's when you can't save the tooth, right? So what you need to do in that scenario is that usually if the crack has gone to the second layer, you need to protect it by clipping the tooth so that it doesn't split in half, right? So best thing to do is usually you want to crown that tooth. There are times when the crack is deep enough but you don't know it yet, and crowning the tooth will save the tooth from breaking further, but it does not necessarily save the nerve. So if the nerve continues to cause some pain in that tooth, you need to see your dentist or a root canal specialist to get a root canal treatment. And if that happens before the crown, then that's fine. You can just have a crown right after. That's important. And sometimes it is done concurrently. You have a temporary crown in place, you get the root canal treatment done while the tooth is still protected and safe, and then the permanent crown goes on top after that. Or in some scenarios where a crown is put on and then later on the tooth starts to hurt. Don't worry, you can still save it. You can actually have the root canal treatment through the crown, okay? Hopefully, whenever you get a crack, the most important thing that you really need to know is get urgent attention. And at Dental Designs Clinic, we aim to save every tooth.